Antimicrobial resistance is rising rapidly across Africa, with the World Health Organization warning that deaths linked to drug-resistant infections could quadruple by 2050 if no action is taken. Now, in Cameroon, the misuse of antibiotics, including the common practice of of buying medications from roadside vendors, continues to expose citizens to dangerous and untreated infections. Now, this, as the world marks the Antimicrobial Awareness Week, this year we talked to members of the Antimicrobial Stewardship Committee from the CBC Health Services in Cameroon. That is Dr. Atem Achidi, a pediatrician, and Dr. Kinge Peter Ndumbe, an internist. Hello and welcome to the program.
Thank you very much.
So you guys are going to talk more to understand the risks and the steps Cameroonians can take to stay safe. But before, we would like to understand what antimicrobial resistance is all about.
Okay, thank you.
All right, so we're celebrating the World Antimicrobial Awareness Week, which runs annually every year from the 18th to the 24th of November. And we have just as a major aim or objective to create awareness amongst everyone, the general public, stakeholders of health, and even policymakers on the fact that antimicrobial resistance exists, and for them to know what they have to do or the part that they have to play to reduce or curb its incidence. And so this year we are here to kind of throw more light and throw more awareness on what antimicrobial resistance is. So antimicrobial resistance, it goes without saying, is just when antimicrobials, which are antibiotics or medications, become resistant to the germs that they have been created to treat. And when they become resistant to these germs, it makes it difficult for the person to get well, because it means the infection that is going on in the person's body is going to persist. And when the infection persists and it cannot be treated, then it can lead to many things like complications and even death.
Now, in Africa or the African region, Dr. Kinge, it's been recorded that close to 1 million people have died from antimicrobial resistance, and that's in 2019, that's statistics, and the numbers could rise sharply by 2050. How do you think that this affects the way elderly persons in Cameroon can become vulnerable to infections?
So, yeah, thank you. So antimicrobial resistance is actually a growing burden because of the fact that we are more exposed to these medications, and basically it's just the bugs which we usually are the culprits, viruses, bacteria, parasites, fungi. But now the medications that should act against them no longer work. So what happens is we now create these very resistant bugs that now are more dangerous. They cause more complications. And with the elderly population who are plagued by other comorbidities like high blood pressure, diabetes mellitus, Parkinson's disease, which impairs their mobility, you realize that if they catch an infection, already their immune system is challenged because of the other health conditions, but then maybe they don't have access to health care. They are already plagued financially by the other medical conditions. So these bacteria which are resistant, or the fungi and all of these, the infections which don't respond to the conventional antimicrobials now bring an increased financial cost, prolonged hospital stay, and it's addressing a population that is already vulnerable baseline. So now, it's a big problem.
All right, being a big problem, what do you think that pharmacists and health workers can do to help reduce the antibiotic misuse in the country?
So yes, it has to be a multidisciplinary approach, and at the level of the community, first of all, it's, hey, don't self-medicate, please just visit the hospital. Don't always ask for a medication. Like in the younger population, which Dr. Erica handles, the advice is that, okay, fine, when your child has a flu, a cold, you don't always need to get antibiotics. Just visit the hospital. It could be a viral infection. And also now, at the level of the medical practitioners, let's not prescribe antibiotics for every disease condition. Not every fever requires antimicrobials. Not every flu, every cough requires antimicrobials. So those are some of the steps that we can use. But if we can also encourage these roadside vendors to rather refer the patient to the hospital instead of quickly aiming to make money and sell these antimicrobials. So all of those steps can actually help to curb the burden of the antimicrobial resistance.
Now, Dr. Atem, as we observe Antimicrobial Awareness Week, what specific actions should parents and communities take to use antibiotics responsibly and also protect future generations from untreatable infections, especially children?
Okay, so with the children population, they are more prone to receiving antibiotics because they are dependent on their parents. So their parents have to practically make all the health decisions for them. So it starts with educating the parent to know that not every infection should be treated with antibiotics, particularly in the child age group. A lot of them suffer from viral infections, which do not need antibiotics as treatment. But I have parents coming demanding for antibiotics or even going ahead to pay for them at the pharmacies. So the first thing I would want is, at the level of the policymakers, it will be good to make antibiotic a prescription medication. That means something that should not be easily gotten over the counter. Because if they are gotten easily over the counter, then the parents have the opportunity to bypass us, the health professional, to go get it themselves directly and then treat their children. And then the second thing would be to help in sanitation generally, because a lot of these microbes that we pick is from dirt. If we keep our environment clean and everywhere neat and tidy, then we're going to reduce the incidence of and the chances of getting infected, which will require us, to get treatment.
Now, I see on your T-shirt, the theme for this year is Act Now, Protect Our Present, Secure Our Future. What is the significance of this theme when we talk about the awareness, the Antimicrobial Awareness Week?
All right, so Act Now means antimicrobial resistance has come and it's in our midst. And if we don't do anything about it, it's not going anywhere. So the action we have to take is right now to prevent. We already saw the numbers. We had almost 4 million people die from antimicrobial resistance in 2021, and that number is projected to double by 2050. So if we don't start acting now, then we are doomed because the numbers are only going to increase. And the only way we can secure our future is with the actions that we take now. And everybody needs to be on board with it, both the general public, the healthcare professionals, and even those who are in charge of policy making. We all have to work together to make sure that we realize this dream.
Now, Dr. Kinge, at the level of your health institution, how are you guys trying to push for the change and influence policy and also ensure the health and safety of all Cameroonians, especially the patients who come to you?
Okay, so we have different committees at the level of the hospital. We are the Antimicrobial Stewardship Committee, but we also have a Drug and Therapeutic Committee. So what we try to do, and alongside the Infection Prevention Committee and several others, but what we try to do is, first of all, we educate ourselves because we are the stakeholders in the medical section. So we try to educate ourselves on, first of all, infection prevention measures, how to ensure that we don't spread the infection from one patient to another. And also we try to ensure that, okay, we actually have evidence before prescribing these antimicrobials. And then at the level of the pharmacy, we have a double check. So the pharmacy is actually empowered to go through the consultation and ensure that, okay, for this antimicrobial which has been prescribed, there is a fixed diagnosis and also there is a conventional duration of treatment with the right dosage. But then, if we have patients who come back with a persistent fever, for instance, we have also empowered our lab to make sure that, okay, if maybe the initial investigations were properly done, and then maybe encourage the physician to do cultures such that we actually make the right diagnosis and give the right treatment. So those are minor steps which we are taking, but also we educate the population. This week, we actually sent a couple of staff to different Jangi meetings in the country so that they educate the population on, hey, please, if your child is sick, if you're ill, you have a relative, please go to the hospital. Don't be eager to just buy roadside medications, and also respect your prescription, because it doesn't just end at the level of a family relative took some medication, but don't take the remaining drugs which are left. And if your duration of treatment is, say, 5 days, 7 days, please respect that duration of treatment. So those are some of the steps which we are taking to fight against the rising numbers.
Now, as we conclude our talk this day, if there is one message you want the person watching us right now to retain about antibiotics, what would that be? I'm throwing the question to you, boss. So
Okay.
You can choose ladies before gentlemen. Or
Definitely.
Okay, so if there's one message I have to say, given that I'm a consultant pediatrician, it will be to tell parents who are in charge of the healthcare of their children to not self-medicate these children. Always seek expert consultation so that you can be given the right prescription and the right drug.
And to the man in the house.
Yes. So it's the same advice which we give. Now, what I would tell people is you have a very key role to play in fighting against this rising burden. So please always respect the prescription from the medical practitioner, complete your treatment, and secure your drugs. Make sure your children don't have access to these medications and then they take them and it contributes to the problem.
Thank you very much for your insights. And that's it. We've been talking to Dr. Atem Erika Achidi, a pediatrician, and Dr. Kinge Peter Ndumbe, an internist from the Etougebe Baptist Hospital in Yaoundé, where we have been raising awareness on the misuse of antibiotics in line with this year's Antimicrobial Awareness Week. Thank you for staying with us. Until next time, do have a pleasant time in our company. Bye-bye.